So just looking at recent data regarding cancer, a little over 1 million Americans per year are diagnosed with cancer. And this is pretty amazing that 1 in 2 men and 1 in 3 women will develop cancer in their lifetime. As of now, we have over 10 million cancer survivors. So fewer people are dying from cancer. And we've also talked about in class that cancer is likely to overtake heart disease as the #1 killer in the next 20 years. One of the way scientists and physicians look at cancer data is to look at survival rates at 5 years. That's the big benchmark. So although we haven't cured cancer, we've done much, much better in getting people to survive longer with cancer. Interestingly, the poor survival is often in young adults, and this may have to do with access to insurance or just thinking that they are low risk of cancer versus children and elderly. Health disparities, really important. So there are many health disparities when it comes to cancer treatment. Socioeconomic status, your income, your lack of insurance. And if you open up the link on this page that looks at the data, that for example, more Caucasian women get breast cancer, but African American women are more likely to die of it. They do tend to get a more aggressive form of breast cancer, especially if they're younger, and that is a contributing factor. But if you look at that page from the National Cancer Institute, cancer.gov, they discuss what are some of the reasons for health disparities. Cancer is a very expensive disease. There are huge medical bills even if a person has insurance. Some of the drugs may not be covered. They may have large copays. There may be frequent hospitalizations and surgery. So cancer is a very expensive disease to have. So $78 billion in direct medical costs, $18 billion in lost productivity, and then also lost productivity from premature death. Medicare, we talked about Medicare. Americans over age 65 are supposed to have a supplemental insurance. Medicare covers 80%. So they have what they call the Medicare Part B packages that you have to choose. So you have to choose the best one that's based on your lifestyle. But it's kind of sad that over 500,000 people will die. In 2012, about 1,600 people died per day of cancer. The most common cancer that we are probably aware of, and this is October, so it is definitely breast cancer month. You can't even turn on an NFL game without seeing pink. So almost 200,000 new cases per year, and it's a 1 in 8 lifetime risk for most women. That, according to the Susan G. Komen Foundation. So it's the #2 cause of cancer death in women, and we'll get to what's #1. Like many of cancers, other cancers, age is a risk factor. 40 and older, highest in older women, 70 plus. Female gender, that seems kind of a duh, but men can get breast cancer. It's very rare, but it does happen, and they often don't get caught because they tend to think that they can't get breast cancer. And so these are the gene mutations. So if you remember reading about Angelina Jolie, one of the reasons why she had a preventive double mastectomy is that she has the gene mutation, which gives a much higher lifetime risk of developing cancer. So that's an individual decision if women choose to have a preventive mastectomy. If you have an immediate family member, so once again, mother, sister, if it's a more distant family history, there's some risk there, but it's not as pronounced as if it is a first-degree relative. Women who don't have children or they had their first child, this has more to do with your lifetime risk of estrogen exposure and radiation exposure during youth. So interestingly, someone who's maybe had childhood cancer, they underwent radiation treatments, they're at risk of future cancers later in life. So, or if people had a lot of x-rays for whatever reason, So they do have to be really careful about lifetime radiation exposure. And then even as a case too with looking at how many mammograms should women get, because every time you go for a mammogram, it is an x-ray. So you are getting exposed to radiation. So that's why some of these guidelines and these screenings are controversial. Most women are going to have their first mammogram age 40, although some recommendations start age 50, and earlier if you have the gene mutation. So if a physician orders a mammogram, it is going to be covered. That is one thing that even if your health insurance is a grandfathered plan, there is a federal mandate that all insurances must fully cover the and the mammogram if it's ordered by a doctor.